Good evening. I'm Dr. Robert Peppercorn, and this is the Medical Explorer. As a specialist in skin diseases and allergies and as host of this program, I'll take you on an exploration of the medical communities of our Northern California counties and bring you behind the scenes of medical care practices right here in our local areas. Tonight, the Medical Explorer will take you into a very unique dental practice that combines both the fields of pediatric dentistry and orthodontics in a large state-of-the-art facility. This is the Yuba City office of Dr. Thomas Iverson and Dr. Wendy Vota. This husband and wife dental team offers our community a unique opportunity to combine both the practices of prevention and treatment of your child's dental problems with a super modern facility to provide for the straightening and alignment of teeth for people of all ages. Have you ever wondered what you'd experience if you chose to take a child or yourself to an orthodontist to improve the appearance of your smile? Well, stay tuned. In the Pharmacy Corner tonight, our award-winning neighborhood pharmacist will tell us remedies for the annoying and uncomfortable problem of the sore throat. Are there easy ways to relieve the pain of a sore throat? Well, we'll learn the answer to this question and others about sore throats in the Pharmacy Corner tonight. This evening's program will be extremely timely and informative, and I hope that you'll stay with us for the next half hour. Before getting to our topics tonight, let's take a brief look at medical news. A new laser device is now available in Yuba City that can effectively treat facial blood vessels and age spots without causing scarring. The new laser technique uses selective wavelengths of visible light that are absorbed by individual parts of human skin, which would include blood vessels, brown spots, and other skin defects. The laser light carefully removes these unwanted blemishes, leaving the remainder of the skin intact without causing scarring. This new laser is now available to treat cosmetic problems here at the Skin and Allergy Medical Group. And you can call us for more information at 671-4182. And you can be sure that we'll feature this new laser on an upcoming episode of the Medical Explorer. It's now time for us to visit our Pharmacy Corner as we learn the latest up-to-date information on the world of drugs and medications from one of our area's most respected neighborhood pharmacists. Returning tonight in the Pharmacy Corner is our award-winning registered pharmacist, Bob Church from the Medicine Shop Pharmacy in Marysville. Bob, welcome back to the Medical Explorer.
Thank you. It's nice to be here.
When we speak of sore throats, what do we really mean by the term sore throat?
Well, sore throat actually is a symptom of irritated throat tissue. And when we hear the term sore throat, or when people say they have a sore throat, they're almost always referring to the pain that they experience when they swallow.
I see. What are the causes?
There's a lot of causes for sore throat. Some of them would be smoking, sinus drainage, air pollution. Some medications can cause sore throat, upper respiratory tract infections. There's a lot of reasons for getting a sore throat.
I guess when I think of sore throat as a patient, I think of the virus, the upper respiratory infection.
Absolutely.
You get a cold and then you hope that the next few days you're not going to get that terrible pain in the back of your throat, but sometimes you can't predict. Interesting. Yeah. Sometimes it goes to the sinuses, sometimes it goes to the throat, sometimes it goes to the voice, lungs. You never know where those viruses are.
But it's always a sign of warning, isn't it? Right. You're always wondering what's going to happen next.
What's next? That's right. Are most sore throats serious problems?
Actually, most sore throats are sort of a benign, self-limiting nature that sort of lend themselves to being treated with over-the-counter drugs. However, I want to caution that a sore throat can be an indication of a very serious underlying cause, maybe a medical disease. It could be that your body is becoming toxic to medication. It could be the sign of a serious infection, either viral or bacterial.
Tell me about some medications that cause that.
Well, one that comes to mind, phenylbutazone, which is an anti-inflammatory drug. We don't use it much anymore, but I can remember when it was used a lot, and it can cause some very serious blood problems. One of the indicators that that is happening is sore throat, along with some other symptoms. But So, you know, medications obviously play into that.
So you would then tell people if a sore throat has been going on for several, let's say more than a week or two, it's time to get checked out by their doctor.
Oh, most definitely.
But if someone has a sore throat that they're pretty sure is due to a cold, a virus, then they can come in and try some of the over-the-counter products.
Sure.
Tell us about some of these products that are available.
Okay.
What forms of dosages and things are used?
Excuse me. Well, let's take gargles and mouthwashes to start with, because I think that those are probably the two least effective. They're probably good for removing mucus from the oral cavity, but as you know, when you gargle, the tongue rises. That limits the amount of medication that actually gets to the throat.
Oh, that's interesting.
So for those reasons, I don't think that really those are good products. Sprays are good because sprays can be aimed to the back of the throat. And
are they safe?
Yes, they are. And then you swallow the medication and it comes in contact with those irritated tissues. The other one, which would be the troche or lozenge, this is a dosage form that goes back to like 1500 BC. I mean, you know, this has been around a long time. But it's that hard type of dosage form that's a disc shape. You suck on it, the medication is then displaced down the throat, coats the tissues, and you get relief from the sore throat.
What about aspirin-containing chewing gum? Does that do anything?
I don't even sell that product. Really? I don't like that product. I don't think there's any reason for it. That product, under certain circumstances, could cause ulceration of tissues.
Oh, great.
I just, if you want aspirin, take an aspirin tablet or something like ibuprofen, an anti-inflammatory. You'll get the same amount of relief. You don't need to suck on
I remember when I was
aspirin.
a kid, I tried those things. I don't know if it helped or not, but we tried anything we could. It was always such a pain. What do you think is the most effective?
I think actually the spray is good, but I think the lozenge is more effective. The lozenge releases the medication slower. You have more contact with the tissues because you're constantly sucking this thing. I think that's the way to go.
I guess combining that with taking an aspirin or Tylenol, I guess people trying to avoid aspirin, sometimes Tylenol might just help be a pain reliever too.
Absolutely.
So it could work together.
Sure.
Do you tell people to use one or the other, or avoid aspirin, use aspirin? What's the current thinking about that?
Well, I'm not so much into that. I think actually for that type of pain, Tylenol is a better product. I'd like to stay away from the aspirin for the side effect reasons, so I think Tylenol is probably a better product.
Do you have any special advice for people that are on their own trying to treat these problems?
Well, I think that if you have a sore throat and you want to treat it with an over-the-counter products, first of all, look at your throat in a mirror. If you have a white exudate or patchy discoloration of your throat, you need to go to the doctor. If you don't, if your throat is just red, irritated, you can use the over-the-counter products. But if you still have the problem in 2 or 3 days, or you have swollen glands, or you have fever or chills, other symptoms, you need to go to the doctor and get yourself checked out.
Like that, Bob. Very good. Thank you. As usual, very useful information. I hope our viewers will discuss their concerns regarding sore throats with their physicians and pharmacists very soon. And as usual, we look forward to you returning to the Pharmacy Corner on future programs.
Thank you.
Now on with the Medical Explorer. The concept of a two-career family is not at all unusual in the 1990s. Even the concept of a husband and wife both being doctors is getting less rare in the United States. However, we don't commonly see spouses in two dental specialties that are able to create a partnership where both specialties fit together so perfectly. Well, tonight we're about to visit a practice where the specialties of orthodontics and pediatric dentistry fit together so smoothly that the experience of being a patient is truly a pleasurable one. Let's leave my Skin Analogy Medical Group studio in Yuba City and travel down Live Oak Boulevard as we continue the Medical Explorer from the offices of orthodontist Dr. Thomas Iverson and pediatric dentist Dr. Wendy Vota. Dr. Iverson, good to see you. Thank you for having us over at your office today.
My pleasure.
I remember back, I guess it was late 1992, you opened your facility here.
Yeah, that's right, back in October of '92.
and there was a big open house, and I'll never forget how the positive feeling I got coming in here and seeing how state-of-the-art this facility is. So it was my goal that someday we'd come back and be able to show the entire community how your office and Wendy Vota's office, your wife, pediatric dentist, have set up here, and that's what we're going to do today. I'd like to ask you a few questions about being an orthodontist, because our community, most people know what that is, but they don't really know what's involved in that type of career path. Is it part of dentistry in the sense of going to dental school? What do you have to do to become one?
Sure, that's a good question. Yeah, you do have to go to dental school. It's a 4-year program after college, 4 years of college, and you go to 4 years of dental school. Then there's an additional 2 to 3 years after dental school to become a specialist in orthodontics.
Is it a highly competitive field to get into? I mean, can any dentist just decide he wants to do it, he or she wants to do it, or do you have to go through a lot of selection to get into that?
Yeah, it's very competitive. You know, the top 5% of the dental school class normally gets into the orthodontic program.
We know like a community such as this has many, many dentists, but very few orthodontists, so that selectivity, I guess, comes in there.
Yes.
Where did you actually go to school?
I went to Baylor Dental School in Dallas, Texas, and then I went to Northwestern Orthodontics program in Chicago, Illinois.
So the Yuba City is quite a big change from the Midwest, isn't it?
Oh, yes. Yeah, but more like the Midwest and Southern California, where I grew up.
Oh, I didn't realize you grew up in there. So Southern California, then Midwest, and now back Northern California.
Yes.
Well, what we'd really like to show our viewers today is what happens when a patient comes into an orthodontic practice, what they go through, and see how your new office really makes everything fit so smoothly together. So can we take a look?
Sure, let's go.
Great. If I had a child that was, you know, growing and I saw the teeth weren't coming in straight, could I just call you, or how does that work?
Yeah, the best thing to do is to go to the general dentist and ask the general dentist, you know, is this child ready for braces? You know, are all the cavities taken care of? You know, is there anything that needs to be done before they go see the orthodontist?
Is there a particular age that you'd want to wait to at some point?
Absolutely. The best time to be, you know, first examined is age 7. That's when the problems can first start developing and showing up, and a lot of times we can catch the problems early, alleviate the problems at a young age, and prevent horrible problems you know, as they occur.
So what happens the day the patient comes in now to see you in this new patient special examination room that you have? What would actually go on?
Well, we would first get a thorough health history of the patient. We would you know, give the tour of the office, show the patient our sterilization area, our x-ray area, and kind of get them familiarized with the area. Then we'd bring them back here. I'd do a thorough examination on the patient, document everything, and then we'd give them an idea of what would be necessary to correct their problem, address their problem, and tell them what their options are, what can be done to correct it.
I understand that nowadays computers are beginning to be used for taking visual images of a person's face, and you can mix that with their x-ray images and get all kinds of plans for things that may be done. Can you show us what some of that can be done?
Yeah, we're lucky enough here to have a computer imaging system that is the only one in the area that we're using to, for instance, on this patient here, we can get an idea. This patient needed to have an actual jaw surgery. Their jaws were so out of position that we needed to reposition them surgically, and we can get an idea from the imaging system what they would look like before the operation, what they would look like after the operation, and use that to study how we can move the jaws.
So in your work, you're not actually doing surgical operations, though. You would be able to plan in conjunction with an oral surgeon how everything would work together.
An oral surgeon and myself would get together and we would treatment plan the patient, decide for that patient exactly how best we can correct their jaw problems. And
so if a patient may not just have the directions of the teeth may not be just right, they may actually have bone problems with their jaw, the whole shape of their face may need correction.
Exactly.
So modern orthodontics is not just straightening teeth.
Not at all.
Very good. So what would you actually see here in some of these photos?
Well, this particular patient, they had their lower jaw was ahead of their top jaw, and their lower teeth were ahead of their top teeth, so much so that I could not bring their teeth in proper position with each other without actually repositioning the jawbone. So what we did was we treatment planned this patient for a lower jaw setback, and we get an idea of what they will look like after the surgery from this imaging system that we have here. And we can predict from here pre-surgical image, computer prediction of that patient, And the final post-op is this is what actually she turned out and how she actually turned out.
You can actually have a predictor of what she should look like based on what your computer imaging system can do.
Exactly.
That's fantastic how they can use these images electronically now and make predictions.
Yeah, it really is. It's a major advancement. I'm real excited about it, and you know, it's Orthodontics has come so far in the last 10 years. It's unbelievable. You know, the parents of my parents or patients are always coming in and saying, "Geez, you know, when I had braces, it was horrible. We had these bands around all the teeth, and now we actually glue the braces right onto the teeth. There's no big heavy metal look. We have gold braces, clear braces. It's just unbelievable how much orthodontics has changed just in the last 10 years."
This is an incredible room with the multiple treatment tables and computer and all of your models. It's just fantastic. It's just, I just can't imagine what it's like when you have patients everywhere and doing everything. What's it like in here? What's going on with the patients?
Well, I'm really fortunate that I have 4 exceptional assistants that are absolutely, you know, helping me with every patient. So basically what I do is we plan ahead and we have an idea of what we're going to be doing for that patient at the next appointment, and then the assistants can read the chart and take over and initiate the patient's treatment at that time when they come in.
About how long is an average orthodontic treatment? I don't mean the actual session in the office. I mean, how many years or months does it go on?
That's a good question. Everyone's a little different. You know, it can be as short as 2 or 3 months. It can take as long as 3 or 4 years. Most of the time, the average is probably about 18 to 20 months.
So during that 1.5 to 2 years, the patient's going to be coming in here many, many times as you do the initial applying of the appliances and then watching them, adjusting them. Is that what happens?
Absolutely, yeah. We get to be real good friends, and it's just, you know, it's a real fulfilling experience to get to, you know, the opportunity to get to know these people. Whereas in general dentistry, a lot of times it's just real quick. They come in, you don't see them again for 6 months. Here in orthodontics, we see them over and over again for, you know, month after month. And
give me an idea what it's like. The patient first has to go through the examination room, which we've discussed. We see they get x-rays, you have the different tests to do. Then you may measure them by the little models and things like that. Mm-hmm. Then you have to have those models, whatever appliances you're going to use made. And these are what people refer to as braces. Now, braces seem to be so many different things nowadays.
Right, they've come out with clear braces, you know, usually the traditional silver braces, and they have now gold braces even. So it's, you know, it's up to the individual. Everyone can make up their own mind. They all work the same way. It just depends on what the person's personal preference is.
And you have different colors now. I've seen kids come in my office with color bands and things.
Yeah, we have a ring. They can select what color they'd like to have applied to their braces. These are little rubber rings that we use to hold the actual wire into the brace, and they can select what color they would like. A lot of times they'll get red and green for Christmas, or for Valentine's Day now it's pink and red, and it's just fun.
It's amazing to me that you can have someone come in with teeth sort of going in all different directions, and through the use of different bands and appliances, you're able to pull these teeth into a direction that makes them so uniform and smooth. And I can't imagine how you're able to conceive of that type of plan. And of course, that's what you went to school, besides dental school, 2 more years at least of training to do.
Right. Yeah, it's amazing. You know, the body's an amazing thing, and the bone of the body. It's just, you know, you apply a pressure, and the bone will dissolve on that side where the pressure's applied, and that's what allows us to move teeth.
So when you see a patient, you're always thinking of move this direction, that direction, what different tools you'll need to do that, how to adjust it different ways, and wires and bands and all of that.
Yeah, every appointment you're basically re-diagnosing that patient, trying to figure out exactly what they need to have done in that particular point in time. So it's fun.
Dr. Vota, you're in a very unique dental specialty for this community. You're a specialist in dentistry and in child dentistry. Mm-hmm. In order to become a child dental specialist, what does one have to do in your training? What's that all like?
First you have to finish dental school, so that's 4 years of regular university college training, and then 4 years of dental school, and then after that it's an additional 2 years.
So we've learned on a previous part of our program with your husband, Dr. Iverson, an orthodontic specialist, that he had to spend 2 years as a specialist, training to become a specialist, right. And you've now done the same thing.
Exactly. Mm-hmm.
I don't think people realize that. They probably feel that you've just, it's not saying just gone to dental school, but you've gone to dental school plus those extra 2 years.
Right.
What goes on during those 2 years that makes that such a unique area?
You take several areas, learning about child development, child psychology, and it's also hospital-based, so you learn to work with children in the hospital if they need to have work done under general anesthesia. You work with handicapped children, so it's just solely dealing with children and learning how to work with them.
I would think it wouldn't be at all easy to work with kids that really can't understand a lot of what's going on. I mean, a lot of them can too, but some don't. And being able to get them to cooperate in something that's as scary as this is?
Yeah, you need a lot of patience, and you need to describe things to them in fun terms, in easy terms, and show them things first before you do it to them.
A lot of us, I'm a new parent now, and I don't really have the concept of knowing when a child should go to a dentist. You know, we all know that their teeth start coming in that first year, and you say, gee, that's fantastic, and you all count the teeth, and you hope that they're not getting decayed, and that but I just can't imagine, you know, brushing the teeth of an infant and all of that care that has to go on. How do we know what to do? I mean, what should the plan be?
Well, they recommend that children be seen before their first year, just so we could talk to the parents and teach them how to clean the teeth and to recommend discontinuing the bottle or nursing by age 1. So it's a lot of educational plus checking the development of the teeth and just making sure everything's okay. And it's basically a quick check. You don't do much with the child. It's just a very quick exam and talking with the parent.
Should we be brushing our kids' teeth at that age?
You should be. As soon as a tooth comes in, you should be cleaning it.
What does that involve? Not taking out the dental floss or anything?
No, not yet. But either washing with a wet washcloth or a toothbrush. And a lot of them don't like it, but it's quick, and I would recommend doing it to prevent any problems.
Would that be on a daily basis or really after a daily?
Yes.
You don't have to push every meal at that point.
No, if you do it thoroughly every day, that should be enough, once a day.
Well, I mean, we're possibly getting there. We've taught our daughter Leanna to take the brush in her own hand, and we'll move it around and try to get her to do things.
Right, but you still need to do it to do a good job.
Okay, let's assume then, which I guess I haven't done, but let's assume then we did the best we could possibly do for a new child. They'd come in before the first year, and you'd check them over, make sure there's nothing really strange going on, some developmental abnormalities such as that, and then when should they come back again?
I would say if everything looks fine at age 2 and then at age 3, so once a year. And then when they're age 3, then they're old enough they can sit in the chair and cooperate for dental treatment. And then it's every 6-month appointment.
Just like an adult would do.
Right.
I think this is all fascinating because it's just great now we can do preventative things, because as a kid I remember having cavities as a child and going through all the problems and not enjoying that at all. And now things can be hopefully prevented.
Right, that's the goal.
The issue of fluoride comes up a lot too. A lot of us in this community are on wells rather than city water, and we don't have fluoride in our water. What should we all be doing in that situation?
You should definitely be taking a fluoride supplement, because it's been shown that fluoride does reduce the incidence of decay by about 65%. So it's a good thing. I give my daughter fluoride. She's about your daughter's age. So it wouldn't be, the easiest thing is to have fluoride in the water, but not too many areas around here have fluoride in the water. So then definitely take the supplement.
Now, I've heard patients of mine mention that they've been to their dentist who've done fluoride treatments, and that confuses me. I don't understand. You're giving fluoride, but what's a fluoride treatment? What does that mean?
That's just a concentrated form, a gel form, which you apply to the teeth. It's a topical form, and that is good for preventing cavities or preventing starting cavities. It's just a treatment, whereas the fluoride supplement, it's both a systemic and a topical effect. So it helps the developing teeth in addition to helping coating the teeth and helping against cavities.
There really has been a change since the 50s when I was growing up, and the number of cavities, and when we didn't have fluoride, and now today there are less cavities. Is that really showing up?
In communities where there's fluoride in the water, yes. Or yeah.
Now, I love your new office here. I was able to come to the open house, and I was so impressed, and I'm impressed today again seeing it, over a year later. Mm-hmm. You have so many special features designed for kids, and of course the orthodontic side has so many special features also. When you come in the office, you even have a special waiting area for kids. What goes on in that when they come in the office there?
Well, we have a special play area, so the kids aren't sitting there getting bored or anxious about the treatment. They can just go in the playroom and play or draw on the chalkboard, so hopefully alleviate any anxiety and help them forget about if they're a little bit nervous about coming in.
And you have that in a separate waiting area from the orthodontic area so that the teenagers and adults over there don't have to be watching the kids run around and scream and all that.
Right.
Has that worked out pretty well?
Yeah, so far very well.
Then in your actual treatment rooms, which we're going to take a look at next, you have special things organized for that too. So why don't we head over to the treatment area?
Okay, great.